Hi, I'm Stephanie, and I will be talking to you about depression. Depression is a psychological disorder that alters the mood of a person. It is a condition that can develop over a period of time, or it could happen suddenly following any life changing events. Some of the causes of depression are relationship issues, financial struggles, alcohol or drug abuse, loneliness, unemployment, anything that causes high stress experiences in a person. And like I stated, also it can be situations from the past that have had a severe effect on one's life. There are different types of depression. The major clinical depression is normally genetically transferred, so that occurs mostly when there's a history of depression in a family. The chronic depression, which is also called dysthymia, chronic depression is a little different because in order for it to be diagnosed as a chronic depression, it must occur for a consecutive period of 2 or more years for adults or 1 or more years for children or adolescents. So that time frame is what distinguishes it from the other types of depression. A typical depression it occurs in cases where there is a positive impact that can alter the mood as well. So it's almost like if the positive impact can act as a reversal, then that's the a typical depression. Postpartum depression is the result of childbirth. So usually when mothers experience childbirth, they may have some postpartum depression afterwards. Bipolar depression consists of constant mood swings, but they're not normal mood swings as to where you may be happy, sad, or kind of in between. The bipolar depression, you're either extremely ecstatic or extremely gloomy. There's no I'm okay in between. There's none of that with the bipolar depression. The seasonal depression, which is also known as SAD, is it must occur for years repetitively in order to diagnose it as seasonal depression. So, for example, if a person is depressed in the summer and then for spring, fall, and winter they are not depressed, then and it occurs every year around the same time, then it may be safe to say that they could be suffering from seasonal depression. Psychotic depression is more like a dual diagnosis where it's the depression and then it may be in a combination with schizophrenia or bipolar, one of those other psychological disorders. Depression affects our bodies. It affects our central nervous system, our organs, our tissues, and our cells. These are some of the things here shown that are affected by the depression. The brain and the heart, obviously, it alters the brain, the heart, because it causes stress can cause things like heart attacks, things like that. These are the tissues that are involved with those organs, and then the cells that are involved with those organs as well. The signs and symptoms of depression, the most common is loss of interest in normal activities, but as you can see, there are several here. Feelings of helplessness and hopelessness. That's a very important one too, because usually a person starts to, if they haven't already been having issues with self-esteem, they usually experience some self-esteem issues with the feeling helplessness and hopelessness. Any increase or decrease of appetite or weight, changes in sleep pattern if you're just extremely tired and fatigued with not so much energy, anger and irritability. People that are depressed generally are very angry or irritable. And self-loathing, reckless behavior, concentration problems. Those that's very important too because the when the brain is altered, it's obvious that you may have some concentration problems following that. You may have a hard time focusing or things like that. The treatment methods for depression are psychotherapy and medication. Psychotherapy is used to treat the less severe cases. Medication is used to treat the more severe cases. So, generally, with the psychotherapy, there's three general kinds: the cognitive behavioral, the interpersonal, and the problem solving. I would kind of go through and explain the difference between the three. The cognitive behavioral therapy helps you to see how behaviors and the way that you think about things play a role in your depression. The interpersonal therapy focuses more on your relationships with other people and how they affect you. And then the problem solving therapy focuses on specific problems that you are facing, and it helps you to find solutions. The medications, antidepressants, they can be prescribed alone or as a combination with another antidepressant medicine. For example, someone may be just prescribed the Abilify, which is a common antidepressant. And then for someone who has maybe a more severe case, they may be prescribed with Abilify and Seroquel or Zoloft, Zyprexa, things like that. There is really no definite way to prevent depression, as it's something that we don't anticipate. It kind of just comes suddenly and we don't expect it. And obviously we don't look forward to it. But maintaining a healthy lifestyle and trying to stay positive about situations, those are two ways that you can attempt to prevent the depression. The short-term consequences are very similar to the signs and symptoms that I showed you on the previous slide. This cycle here is the cycle of depression. And this cycle generally just keeps on repeating and repeating and repeating until one of those treatment methods are sought out. And once that help is sought out, normally the cycle will at some point stop. However, if the treatment is not sought out, then this cycle will just repetitively occur, and it will occur and then it will become a long-term consequence, which is usually the case of an untreated case of depression. So basically, the short-term consequences usually turn into the long-term consequences. However, the long-term consequences can be things like self-harm, withdrawal from social life, strained relationships, flashbacks and outbursts, or psychological disorders may develop. The photo shown is a picture of a depressed brain and a not depressed brain. These are just some statistics. Depression is the cause of over two-thirds of the 30,000 reported suicides in the U.S. each year. I found that to be quite shocking. I did not know that before researching. They say you learn something new every day. And major depressive disorder is more prevalent in women than in men. I actually thought that it was pretty equal, but as again, that was another thing that I learned from researching. And these are just the references that I used for seeking out my information and researching in order to complete my course projects for this assignment. So that completes my presentation, and thank you for listening.